You asked me about thoracic spine injuries.
Yeah, thoracic spine injuries. So I reckon you would have a lot of clients who have thoracic spine injuries, and which is the most complex case that you have ever dealt with regarding spine injuries?
Ooh, I've worked in private practices before, and I've worked in the community myself. I've seen a lot of clients with low back pain. I wouldn't be good doing you justice if I said there was one specific one that stood out,
Mm-hmm.
because to be honest, every single one of them is somewhat complex in their own nature. I would say when I used to work at a neuro rehab clinic back in Adelaide,
Mm-hmm.
and I really enjoyed working with this population a lot more because they either came from traumatic injuries, strokes, um, complete spinal cord injuries. There's a Asia classification, which is basically how bad is your spine, your neural spine injured. And we're talking about paralysis completely or left side, right side paralysis. I would say those clients were the most complex because their journey to from the start to the end is it's so gruesome, and it's requires so much mental fortitude. Whereas people like myself, even disc injuries, low back pain, specific, non-specific, these the starting baseline isn't too bad. Like, yeah, it could be super painful, it can be super difficult the rehab, but when you talk about sort of the spinal cord injuries, thoracic spine, lumbar spine, they're a lot more different because you lose complete sensation, you lose complete motor activation of one side, left side, right side. Some people can't, lift their feet up. It's because of
Yep.
direct impact to the spinal cord at your thoracic spine or your lumbar spine. And I would say these patients are the most complex. I've worked with a lot of them back in Adelaide, and it was such a privilege to work with them. And you get inspired by seeing these people trying to learn how to walk, relearning how to move a finger, relearning how to turn your neck. These I would say are the most complex patients, clients I've seen so far. Hopefully that answers your question.
Yeah. And the last one that with the spinal injuries that I've seen is cervical.
So yeah, cervical injuries, yes.
And it would be safe to say that mostly people who have a sedentary lifestyle get predisposed to this injury quite often.
Yeah, that's true. Cervical, again, your cervical spine, your thoracic spine, your lumbar spine, it's all connected. Or
Okay.
it's just one thing. And there's a spinal cord running through the whole vertebral column. Now, it's the cervical spine. Yes, sedentary lifestyles, there can be a correlation, especially if you're doing desk jobs and higher repetitive movements like looking up and down.
And the forward head movement, what my uh, previous podcast as a guest is my client.
Mm.
So I think in that podcast I mentioned his injury was thoracic spine. I
Okay,
was a bit nervous because it was my first podcast, so
that's all right.
it was actually a cervical.
A
Spine
cervical
injury.
injury.
Yeah.
Okay.
So the major cause for him to acquire that injury is he used to be a cricket player, as well, he used to be a bowler,
Mm.
and his sedentary lifestyle because he used to work. He still works in tech,
Mm-hmm.
and the forward head movement that actually aggravated the pain throughout the years.
Okay. Did he have with cervical injuries? In your neck. You're talking about your neck.
Yep.
So people who don't know what cervical means, you can have injuries with sprains of your neck. So a lot of desk jobs, you get a lot of stiffness around your neck. It can lead to high increased tone or increased activity of these muscles here, the trapezius. Some people can have injuries to your cervical spine or area of the neck where it's radicular symptoms. So the shooting pain, the stabbing pain, sort of those pins and needles in your arms. That's when the neural spine is, I wouldn't say compromised, but it's impinged. And that can happen with dysbulges of your cervical spine. Now, I'm not sure if you're patient, your patient had any sort of these symptoms going down their
I
hands?
feel
or-
like I'm a doctor now.
Well,
we call it it's my client, but when
the-
you say patient, I feel like I'm a doctor.
well, you are a doctor in your own way. This is true.
But
We're
actually, my
helping.
parents actually wanted me to be a doctor, but the only thing I could manage was the handwriting. So
Well, you know how it is. All of our parents in our culture wants us to be
Yeah,
doctors or lawyers.
100%.
Yeah, this is true. That my parents are now just a little bit satisfied, not fully, but it's all right.
My
It's like,
parents
all
is
right.
not still satisfied. I'm getting there. I'm getting
It's all
there.
right. One day, mate. That's fine.
Soon.
We might
for
have to do
sure.
med school soon. Who knows?
Yeah.
But yeah, sorry.
Hmm.
Did your client have any of these sort of radiating symptoms, or was he?
Yes.
Yeah. So that
Surely
means
some.
he probably would have had some neural impingement or some nerve impingement of his cervical spine. So somewhere along the line, C3, C4, whatever, would have been impinged, and he's sort of getting sort of specific, what we call dermatomal sensations, which basically means people might have weird pins and needles or sensations in your first two fingers or last three.
Yep.
All of these sort of symptoms are very specific, and they're different to where your nerves impinge on your vertebral column at your cervical spine. So, funnily enough, I actually see a client. He works at a desk job. He is getting sort of these cervical spine radicular symptoms, which is basically nerve pain, in other words. And he hasn't done anything. There's no trauma that has happened. There's no significant injury where he's, hit his neck or anything, but he just suddenly woke up one day, started getting these pains.
I think it was a. I think he did get those injuries in the um, like in the initial days when he used to play a lot of cricket.
Okay,
That's
yeah.
when it started emerging,
I see.
and it just took few more years for it to actually manifest into a proper cervical injury, and his job played a huge role in that as well.
Mm.
So I think from what he mentioned earlier, it's specifically during COVID days.
Okay,
That's when he got this injury pretty much more aggravated.
Mm.
And I think he started training with me right after COVID. No,
Mhm.
actually 2 years after COVID.
Okay.
So it was actually awful for him. He was in excruciating pain almost every day,
Mhm.
and he couldn't sleep. He would require to sleep on the floor.
Mhm.
He can't sleep on the mattress, and yes, it was a bit.
It's painful.
Yeah, a bit painful. It affects your career. It affects your quality of life.
Of course it does.
And but safe to say now he is 100% cure.
That's awesome.
Yep. And
Yeah, again, this is how your body is so connected. Now,
Yep.
with these cervical injuries, there's things called the deep neck flexors
Yep.
of your neck muscles. I'm trying to keep it not as anatomical, but also in a way where people
yes.
can understand as well. So, in the muscles of your neck,
Yep.
you got something called the deep neck flexors. Now, when they become weak or not activated, like you just mentioned before, your neck sort of goes forward. So you have the forward head posture. So, I would encourage people to, and a lot of boxers do this, but to a greater intensity and greater degree, but just gentle chin tucks, right? This is the equivalent of activating your
Your core.
transverse abdominis, right? So gentle chin tucks. So that's getting you to activate your deep neck flexors, right? There's a difference between doing this extension movement, which activates a completely different set of big muscles that are on the outside, but the chin tuck, which we rarely do, activates that muscle that's actually in the vertebral movements that makes the vertebrae move at that level. So simple things about that. But anyways, I'm not going to get into a huge rehab part of it, but yeah, so it's good that he has recovered. Seems like he's done something right along the way.
Yep. Again, he's a very disciplined guy, so
Yeah.
it was not hard to work with him.
Mm.
I would say the trajectory to his recovery was actually linear.
Good.
Because
Good.
He never flunked on a session. He
That's
never skipped a
Mm.
strengthening exercise. Nothing.
Mm.
It was completely linear, and it was fast as well. It was
Right.
accelerating.
It's really
growth. Yeah. So And there are some other clients who had some injuries, but they failed to do certain exercises that you'll be directing, and they know that it works because when we did go through the program, the initial few weeks they were very much motivated, and they did find the results. And but when you stop after a while, then it tends to come back.
Correct.
So again, with rehab and with every even working out in general, as in like building muscles.
Very
So
true.
the non-lifters tend to believe that okay, if you lift for a few years, you could be Mr. Olympia, and you don't have to lift and you don't have to touch a weight ever since. But it's not like that. Apparently, you don't have an off button on this.
I wish it was true though, so I could have stopped working out and not worry about grinding every single day and going to the gym. But
It's like brushing your teeth, right? As in
that's
like
true.
you had dental hygiene for 30 years and you believe like, okay, you don't need dental hygiene anymore, but it doesn't work like that. You still
No, it
have to
doesn't.
brush your teeth.
Very great point.
And it becomes habitual as well, as in like
It
it's
is.
like part of your routine now, and it's just like brushing your teeth is lifting weights.
It's very true. I think, to your point, and maybe I'm generalizing too much, but the people who are not, like you said, or fall through the rehab, who aren't consistent, they're not just inconsistent maybe with their rehab, but there might be inconsistencies or that certain behavior role played in different parts of their life, whether that's work, whether that's with their family. So I feel like how a person does one thing is how they do everything. And just like with rehab, you said, it's a forever thing, working out, forever thing. It's just having that understanding of it. And yeah, I'm still rehabbing every single thing that I've had.
You managed to injure.
Yeah.
Like it's again the thing with lifting weights as well. Like you will tend to get injured along your journey. So it is kind of like inevitable, some way or the other.
This is true, because we don't know everything.
We don't know everything.
We don't know everything.
I'm still learning as well, and I learn from everyone. As in, like
That's true.
the other day, I was like doing some lateral races, and this gym veteran approached me, and he said, "Do you need to? Can I show you a new trick?" I was like, "Yeah, go for it." He showed me used to use a different attachment, and when I did it, it just.
Did you use the? Yeah, that's so good.
The triangle.
It's really good. The triangle.
Yeah. So when I used it, my goodness, my delts were cooked.
Because you're not using your wrist to hold.
And it's foolproof. So it's pretty much the only hardest part is to figure out how to put your hand.
Yeah, the first part is like, is that going like this or like this? Yeah.
When I ask my clients to do it, and it's always very confusing for them.
It's complicated. I think I've seen Lionel use it.
Yes, Lionel. Yeah. Because I told him it always makes him frustrated first thing in the morning.
Like figuring that out takes about 5 to 8 minutes.
And Lionel did couple of rehab sessions with you because his one was a bit complex as well. So he had an issue with his wrist. Yeah. But safe to say now, after all those sessions with you, man, I mean, like he's going crazy. He's going insane now. He's with the lifts.
That's good.
Oh, he's almost beating my peer personal records.
That's
and
awesome.
It's like, it's not awesome, bro.
I mean, I get it. There's a bit of like, wow.
I'm just kidding, but
you're getting your clients to
happy
achieve
to
really
see
good
that.
outcomes.
Yeah, I'm happy to see that he's lifting so well. He goes all in on the exercise because now he knows exactly how to hold the bar, hold the approach because of the insights that you give.
To be honest, the credit of his rehab is mostly him and yourself. One, because I think it's such a important thing. What you're doing is you have your client care or your duty of care just expands beyond you. You have a scope of practice where you know exercise and movement, and you do it at such a high level. And there's things that you don't know that you reach out and get help.
Oh, yeah,
which is actually the key factor in achieving the best outcomes for anyone that you're seeing, my patients, my clients. And you do this. There's an injury and you train them the best you can and the injury persists, and then you refer them to a physio, which you've done many times with me. And I think not a lot of personal trainers do this. I don't know it's because of this fear of lack of retention or what it is. But if I'm a client and I'm with a personal trainer and I'm getting stronger but I have an injury and the personal trainer refers me to somebody that can help me with it a little bit and I feel better, I'm gonna keep coming back to this person. And the continuity of care is so much better too. Because you're seeing the same person consistently and you have a physio you see as well. Just like as a physio myself, if I don't know something, I refer them off to, if there's whether that's a pain specialist doctor or a podiatrist or a occupational therapist, there's things that are outside of our scope. And sometimes it's okay to say, I don't know. Maybe this guy can help you out a little bit better.
But your expertise, I would actually doubt that would go beyond you. So most of my
Thank you,
clients,
sir.
you have managed to help them recover. Specifically with Lionel, I've saw really good progress in him on his wrist and
Yeah.
just for your information, we're not talking about Lionel Messi. We're talking about
What do you mean? You're not?
just
I'm
talking
high in
about
clients. You don't think so?
maybe soon, probably. Maybe Lionel Messi soon.
Yeah, he would have and that's the thing. Even with Messi, all these high level athletes, they have a huge team involved, right? They
100%.
have probably personal trainers for their lower body. They probably have personal trainers for power training, agility training, physios, doctors, all of this stuff. So,
And they would need that as well because they
course.
play at high intensity
Correct.
and they are prone to more injuries than the general population for sure.
Absolutely.
And the next one that I would go with is
Mm.
the knee injuries. That's the
Ooh.
most complex one that I've dealt with, and I've recently sent you a client who had very serious amount of knee injuries.
Yes, I did see this lady actually
Yeah.
this week. Knee injuries. Yes, I think all injuries are complex. Depends on how you get injured. Knee injuries are also complex depending on the severity of that injury. Now, people have knee pain, obviously. Most of the knee pain is due to osteoarthritic factors as you
100%.
age. If there isn't any traumatic things happening, or there's structural abnormalities that could happen too. Sometimes knees end up looking a little funny, or you're born with a little funny looking knee, and it can happen. You might have a patella that has a bit more space, or there's different things that can happen.
Yep.
And then everyone's heard of your meniscus, your ACL tears, the big ones, the more mainstream ones. They all have their own places, and they all have a different path to recovery. I would say for the general population, if you want to have healthy knees, work out your legs. Squats aren't always the right thing to do. Deadlifts aren't always the right thing to do. A lot of people think, I want to get stronger, I need to do heavy squats or heavy deadlifts. And that's okay. People do this because they don't know any better. They think, okay, and just put some heavy weight onto me and then do some heavy squats and get stronger.
Deadlifts are kind of like a detrimental exercise, which I don't recommend much. Only to people who actually want to learn how to do deadlifts. For in a hypertrophy perspective and in a strength building, maybe just for strength building, yes, you could do deadlift because it's a good functional movement. Because it helps you to pick a lot of stuff from the floor. And other than that, for hypertrophy, I won't recommend deadlift much. Build serious amount of muscles without doing deadlifts. And it is kind of like a detrimental exercise, specifically for beginners who doesn't know how to do it properly. And yeah, there are a lot of other really good exercises to target your legs and your back. And like you just mentioned before, squats. Even without squats, you could build. Actually, squats are really good exercise to build your
Agreed. Yes.
lower body, but even you could pull through without squats as well. So
You can. I do want to correct myself a little bit. I don't want people to think that I hate squats and deadlifts. It sounds like I don't do leg day or something. But look, it's not about the actual exercise per se. It's the technique of it, how much weight you put on it, how old you are too.
Yeah, I'm 29.
Yeah, 29. So it, it squats, great exercise. Deadlifts, good exercise. It's your goal. What do you want to achieve, right? Is that you want to achieve more muscle mass, or you want to have reduced pain in your knees? So it depends. If you want to do powerlifting, yeah, squats, deadlifts, super important. Compound movements activates a lot of muscles. Really, really good. If you have knee pain, you going ahead and doing squats heavy is gonna make it worse,
Yeah,
right?
there's
It's
no
gonna
point in doing.
create, because knee pain is, there's an inflammatory component. You put more heavy weights onto it. You don't let it rest. You add more load to it. You're gonna go into a flare up. So you're just gonna get worse.
That's how I managed to injure my knees.
There you go. You
Like-
probably would know more about rehabbing the knees than I would. As you
Ass
go
to
through it.
grass. Okay, that's kind of like the go-to term that
Yes.
went to my head every time I went under a bar. It's like ass to grass, ass to grass. Okay,
That's
ass to grass. Boom.
Such a
ass to
bro
grass.
quote. I've heard that too.
I did that for a couple of years
Mm.
and I incurred the consequences later on.
Yeah.
And,
And
so-
you were young doing
yeah,
this.
yeah.
So imagine ass to grass
yeah,
when you're
ass to
50,
grass,
40.
with heavy weights and I don't remember my PR and I don't want to remember my PR.
Come on, what's your PR? Tell people
It
what
kind of like it forces me to go back to doing squats and
Yeah.
I'm pretty much happy with doing squats actually. So the ass to grass technique thing that
Yeah.
the bro codes they
Yeah.
preach, and not just bro codes, like everyone preaches that.
they do.
So that actually caused me to
Yes.
hurt my knees, and yeah, I think it would be safe to say that it is the only cause for the injury,
Mhm.
and I managed to recover from it.
Mhm.
I won't say 100% recovery, but
Mhm.
still managed to
working
recover
on
it. Yeah, not so bad now. As long as I don't do much squats, and sometimes I go overboard on lunges. I just if at all I want to channel my frustration to weight training, then I put loads of weights on lunges and just do some walking. Just-
Therapy, that's fine.
That's therapy. Unless if I go overboard, this injury kind of like flares up.
It
Other than
does.
that,
I do want to bring up two really good points. One, ask the grass.
Yeah.
This is important. For example, if you think about sports, like for an athlete, let's say you're a footy player or if you're an American football player, that movement is super essential because you
100%.
need to be explosive from that level of depth. So it's good to do these movements, right? There's a functional preference. There's a reason behind why I need to do this much range and need to have this much power. That's why I'm always going to start with your why. Why am I needing to do this exercise? How much range of motion do I need to put in it? If you're an average Joe, when are you going to go ass to grass and push that much load on a Monday to Friday? Very rarely. So you don't always need to go to 90 degrees. You know, there's nothing wrong with a box squat, right? There's nothing wrong with a nice controlled half squat. It's okay. Even a deadlift, you don't need to go all that low. So if there's a functional preference, if there's something that you want to achieve, whether that's in sport or something, go ahead, do it. So that's one thing. And next thing you talked about was flare-ups. I think this is a super important thing. Generally, when it comes to flare-up, the best thing to do is rest. The best rehab is you have to rest. Deloading, right? In physio terms, you got to deload, reduce the inflammatory component, let it sort of take time, and then you'll build it back up from scratch, graded progressions. And I mean, really, really low weight. At the moment, rehabbing my shoulder, my rotator cuff, and I'm doing maybe 5 kilo presses, like on the ground with my scapula pressed onto the ground. Everything needs to start at a very low level. And then what you need to keep in mind is if you're feeling the pain, you stop right before that. Every repetition. Let's say you get pain after 8 reps, you stop at 7. You keep doing it. And then the next day, a few days later, you'll probably be to 8. Increase the weight a little bit and then see how you go. You got to listen to your body a lot more. Right. And that's why rehab becomes very, very specific. And that's why it's very easy to fail a rehab because there's nuances that we don't understand. And we think that doing this exercise like this is going to help us rehab. It's actually not that at all.
Yep.
It's about how much range can I go into until I start feeling pain? Okay, it's this amount. Okay, let me just stop right before. Let me do 6 to 8. Now let me do 10. Let me do 15. Okay, I can do 15 at that range. Now let me increase the range a little bit more, and then go again, and then maybe up the weight a little bit more. So it's very tedious and it's very boring, but that's the best way to recover. And then you take rests. If you have a flare up, you rest. So I just want to put that out there because I've realized it's something I've realized myself, and obviously the research supports it as well. So
Yeah. So again, I was gonna come back to the shoulder injuries, the
Mm.
deltoids. So we
Great.
just touch base on that, and yeah, I mean, like, to touch base on this
Yes.
again, back to the shoulder. What is the most
Mm.
popular shoulder injury that you get?
Oh, most popular shoulder injury. I think, and this is personally and more anecdotally, I see a lot of rotator cuff tears these days.
Yeah, I managed to.
Oh, you're a full package, mate. You got it all. Like, why am I even here? You can literally give good tips on how to rehab.
Yeah, I was doing bench pressing, and it's like
Okay.
I managed to pull off a 100 kilo bench press,
Mhm.
and boom, that's it. The kind of something popped up, and I went on the eccentric a bit too faster than I'm supposed to,
Nice.
and yep, and then when I tried to push it, and I heard some. I think I did manage to get the 1 rep max, but still, I kind of like kind of sacrifice my shoulder
So,
for that. It's my sacrificial lamb over here.
oh my gosh, you're lucky you're made out of rubber and metal because you're young. But that's the important part. I think people who are older, and I'm not saying that old people can't do things, but I think you have to be very conservative on how you are in the gym. And I think maturing in the gym is accepting that your body's limitations sometimes and
100%.
not necessarily going to lift the heaviest. I've seen some horrendous techniques in lifting and throwing weights, and I'm like, mate, you're 50. What are you doing? Like, you're going to injure yourself, and you're not going to be able to rehab as quickly as Darshiko who's in his 20s, or any other 18-year-old.
That plays a vital role in my recovery. I'm assuming my age.
Of
Because
course,
I
it
was
does.
very
It
young.
absolutely does. Your
Yeah.
recovery time,
Recovery time.
everything is nice and fresh still,
Nice.
right? And you're able to,
Yeah.
And plus, you obviously have the knowledge.
Yeah, 100%.
But yeah, shoulder injuries, there's a lot. With your bench press, do you know what sort of tear it was at all? Or
rotator cuff.
rotator cuff tear? Yeah. And that's the thing. Rotator cuff is people. I think a lot of people know what a rotator cuff tear is, but people don't understand the rotator cuff. What is being insinuated is there's more than one muscle. There's a lot, right? There's internal rotators, then there's external rotators, right? You can tear any one of them.
I did my external one.
You did your external ones, yeah. So yeah, that makes sense. Now, it's
How do you mitigate that issue? And what
great
is your
question.
approach?
So I think it's one, being smart about your sort of rep that you're doing. Whether if you're doing a 1 rep max, all of this stuff, have you trained to do this 1 rep max before? So you have to try, 75%, 65% of your 1 rep max. You have to go in graded progression, and then you need to train the power. If, for example, what you just mentioned was you're eccentrically lowering it and then quickly pressing it forward. Have you done that sort of powerful maneuver, that thing before trained? If you haven't, if you're suddenly going to explode forward, you're very likely to tear it. So that's why sprinters don't even just go ahead and run a sprint, because they're going to do a hammy.
It was an arbitrary move that I did over there.
Yeah.
It's like I did.
Spontaneity with the body is sometimes not the greatest thing. I've noticed if you're doing a powerful maneuver, or power clean, or quick bench, you have to get up to it to be able to do it, right? That otherwise you're gonna, like you said, injure yourself because you're throwing around heavy weights, and that's one way. The other way is not just worrying about parascapular muscle. So parascapular muscle means muscles outside of your scapula, your big lats, your rhomboids, the really cool big muscles. Outside of that, you have to think about doing your rotator cuff. So not waiting for injury to happen to do your rehab. So injury prevention.
Yep.
So doing your rotator cuff strengthening, internals, externals, 90-degree abduction, all of this stuff is very important prior to you get.
Very, very important.
I think it's the young lifters like who are now 15 to 20 who are pretty fresh, still no injuries, they should start doing all of this stuff, just like they're benching really heavy and pressing really heavy. It's not something I did when I was younger, but I wish I had, but I just didn't know any better.
100%.
So that's another way to avoid injuries. And look, when you're young, you're still gonna be young and throw some weights around.
100%. Another thing, just like the rotator cuff stretching that you mentioned, I would like to go on to stretching.
Okay.
How much of an importance do you give to stretching,
Stretching.
post and pre workout?
I don't think there's a lot of evidence suggesting stretching helps to avoid injuries. There isn't a lot of scientific data. I mean, there's a lot of studies on stretches, but it doesn't suggest that you can prevent injuries.
Ego helps to prevent injuries.
Dang, that's probably that's the number one.
That's
Actually,
top.
scratch the last two. I said.
Top of
Top.
the
That's
list.
two. I would say stretching does have its place. Now, why do we stretch? We stretch to bring our muscle, the supposed muscle that's tight or shortened, to its natural length. Now, it makes sense that, okay, let's say I'm doing a sprint and I just woke up in the morning, it's a bit cold, I'm pretty tight. Now, if I'm going to quickly start exploding and running, I'm likely to injure myself because my muscles, if I'm cold and tight and all of these, are working in a mechanically disadvantaged position because they're shortened. Now, you can stretch. I think stretching will help. But it's better to just do a couple of jogs. Maybe do 40% of your 100 meter max, 50%, 60. That's a far better way, I think, to warm up than doing a stretch because it promotes more blood flow. You actually move the joints, more dynamic. Obviously, it's more dynamic. Stretches are more static. They can be dynamic stretches too, but I would prefer more of an active warm-up rather than stretching. And actually, stretching is not a good thing. And I think I'm just going off the rails here a little bit because I talked about sprinting. Stretching is not good for sprinters because you need to have tensile forces, which means you have, like, your tendons need to be somewhat tight in order to propel you. So that's why it's not the stretching part. You just need blood flow. You just need movement to warm your joints up. Right? Does that make sense?
Yep.
So there's tensile forces in our tendons, which actually creates propelling force because the muscle obviously activates and it does what it needs to do. So
it's like an old diesel engine.
Yeah.
As in, like, you gotta warm it up before you take it out.
Yes, correct. And yeah. Anyways, I would prefer more active, just going on the treadmill to warm up rather than doing a stretch or doing a couple of pull-ups, a couple of push-ups on the treadmill. It's far better than doing a stretch before you do something. Hopefully that answers your question.
Yeah. So when I did the shoulder injury, as in when I got the shoulder injury, I necessarily didn't do much stretching, and I had no clue on what to do with rotator cuff as well. So that's how I injured myself. And then I started implementing a lot of stretching in my regime, and actually helped me a lot. And then I kind of like started doing yoga.
Good.
So yoga.
How'd you go with that?
So I mean, like, for flexibility perspective, I'm doing it in a spiritual perspective now.
Oh, good.
But so it's like best of both worlds. You get good flexibility.
That's it.
So again, another issue that I've incurred was, like, due to my flexibility, I would have recurring pains because my muscles are super stiff.
Okay.
And doing yoga actually helped me with my lower back pain.
Mhm.
a lot of yoga
Mm.
yoga movements.
Mm.
It helps a lot
Mhm.
because you're more flexible now.
Mhm.
And I don't exactly know the science behind this,
Mhm.
so please don't destroy me in the internet.
That's
So
fine. I think you're about to get to a good part here.
yeah,
Keep
yeah.
going.
So again, this stretching actually helps a lot with flexibility, and it kind of like gives you an effect on your recovery as well, as in with the lower back. As soon as I started becoming more flexible, my pain started fading away a little bit more,
Mhm.
and I felt that very beneficial. And what do you think
Mm.
the role of stretching plays on injuries?
I think you said something super good before.
Yep.
You said you did yoga and it helped with your
Yep.
low back pain.
Yep.
Now, another thing about low back pain is it has a really good correlation with stress. If you're highly stressed, if you got anxiety, if you got depression, if you're sleeping very poorly, you're very likely to exacerbate current low back pain symptoms you have. You're going to be flared up. And this, I think people might know it, might not know it, but somehow our lower back spine is very sensitive to external stresses, anxiety, depression. People who have anxiety, depression, poor sleep, they have heaps of low back pain. It gets worsened. Now, the reason why I wanted to bring that up is because you did yoga.
Yep.
Now, that's not just a form of stretching.
Yep.
It's a form of mindfulness too.
Yep.
Now, let's say what happens when you're doing yoga? Yes, you're stretching. Your muscles are stretching. You get endorphins because of that. But you're also quite being mindful. It's a spiritual
100%.
practice too. And that also tends to help with low back pain. Now, maybe you didn't make that association, but it
No.
definitely did help.
Yeah.
I think yes, it helped with flexibility and directly helping your low back by stretching and all this stuff. But also the fact that it was such a de-stressing part of your day when you're engaged, that actually helps heaps.
So you store some stress on your joints.
More or less, yeah. It's
When
just
you're stressed, yeah.
it's just the hormonal aspects of it. So
Yes.
when okay, this is going to be another different topic, but there is when you're just generally stressed, you're likely to get more headaches, more pain. Just so people feel things a lot more when you have cortisol in your body. When you're a lot more stressed and depressed, your pains just generally thrive. They love this. Now, there is a classification called nociplastic pain and nociceptive pain. Now, again, I'm not an expert in this field. John Ford might correct me here too. Again, I don't know everything, but from what I know, nociplastic pain is basically a heightened nervous system that increases the pain. It's kind of like a sensitive car alarm. If you go close to it, it just goes off. So your body is the same where if I have an injury and I have a pain, but when that injury happened, I had a lot of stress going on in my life, that injury is going to be way more exacerbated. That is why it's called nociplastic pain. My nervous system is more sensitive, so it increases the pain way more than I'm supposed to get it. Now what happens is now I'm thinking about the pain a lot more. Now I'm more stressed. Now my pain goes up a little bit more. Now it's a cycle. Now I don't sleep well. Now what happens is it becomes more of a nervous system issue than the actual mechanical issue giving you pain. That may have healed, but you're still having pain. Why? Because you're constantly stressed. You're thinking about your pain a lot more. You're catastrophizing a lot more. And so your pain becomes more. So yeah, it's such a wide topic. Pain science is so wide. There's a lot to learn,
And like you just mentioned earlier, like it all comes to your mind as well. How you approach with an injury, and again, it's all anecdotal. I don't have any perfect proof for this, but yeah, with your mind, if you emphasize more on the injury, if you think about it throughout the day, it just makes it even more worse. Like the other time when I got that injury for
actually,
few days.
just to cut you off, it is not anecdotal. What you're doing is what you're saying is absolutely true. It's science based. It does make it worse.
It does make it worse.
It does make it worse. Go on.
So last time when I had that injury, I refused to stay at bed. As in, like I knew what I need to do,
Mm.
because this lower back injury might come in like once in 2-3 years sometimes,
Mhm.
and that's what happened the
Mhm.
other day
Mhm.
when I was doing barbell hip thrust, and suddenly I pulled, and I was like,
Mm.
oh shit. I was familiar with this pain, and it's a pain that I would say on a scale of 1 to 10, it would be
Mm.
11. So it's like, yes, it's excruciating pain,
Yeah.
but at this point I love the pain, not this kind of pain, but I'm so much accustomed to the pain,
Mhm.
and with lifting as well, and you get the soreness, I enjoy the pain. Like,
Yes.
it's all so you can grow immensely if you start loving the pain, but I don't recommend doing it,
No.
as in like
Please don't
not
get
recommended.
injured as
Please
much as
don't get
Darshik
injured.
over here has. I don't recommend it.
Now I'm not saying in an injury perspective.
Yeah.
It's just when you lift weights, super heavy weights, or
Mhm.
like when you do a lot of reps,
Mhm.
you get some soreness, and
Mhm.
you start enjoying the soreness, like
Mhm.
the pain.
Mhm.
It's actually really beneficial.
It's true.
And yep, so that happened, and yeah, I refused to stay at bed. If I stayed in bed, and I would have been even more depressed, because I'm not doing what I have to do, and
True.
the other stuff that I do out of fitness. I
Yes.
couldn't train
Yes.
people because I couldn't move much for a week, so but I still did the other stuff that I do outside of fitness, and yeah, I was doing that, and I didn't. I was mindful of the pain,
Mhm.
but still, I didn't emphasize more on the pain. I didn't think about it much, and that's it. And you just take some rest, just like what you mentioned. Like your body would heal automatically by itself if you give ample amount of rest, and that helped. And another thing that actually helped with injuries is doing a cold plunge.
Mm.
Oh yes, mate. It
Cold
helps
plunges.
a lot. Cold
Recovery.
plunge.
Yeah.
I've at least from the internet,
Mhm.
I've known that okay, having hot showers helps with injuries,
Mhm.
and rather than the cold showers. But I found it kind of like opposite. I don't know. It's like when I take a cold plunge, I've seen like my injuries are so more relaxed now. As in, like I don't feel any pain, and I do the cold plunge again, like early in the morning, as in like
Mhm.
3:34 a.m. in the
Mhm.
morning. I do it, and outside it would be around like 1 degree Celsius or something. But
Yeah.
still, I would go in and take the cold plunge, and it's like coffee, and like it
Mm.
just hits you up,
Makes you up.
and my joints are so relaxed. As in, I don't feel any much pain,
Mm.
and another funny thing about cold plunge is
Tell me.
that it you get a insane amount of pump when you do a cold plunge. It's like
Which makes sense.
my muscles are pumped up after the cold plunge. I was like,
Yes.
and it's good for your brain cognitive functions
Of
and
course.
everything. It keeps me awake. I don't take coffee or caffeine,
Good.
so
Good. Very
cold
good.
plunge is actually really good for recovery. But
It is. Yeah.
when I say it, 99% people would just take it through here and just whoosh. You're
And
crazy.
I understand why they go like this and this because it's really cold
It's
and no one
really
wants to
cold.
really do it. Myself as well. What Darshik is doing is really good though. It's true.
Yeah,
What you
it's cold
it's
plunge does it.
yeah, but you have your own space to it. You have a nice tub and you got ice in there. I wish I had that space to do it. I, I honestly agree. If it would go a long way if everybody could have a nice cold plunge after a really good workout, helps with recovery,
Yep.
reducing inflammation, and hence why a lot of athletes do this as well.
At least do this for recovery. Yep.
Although I don't try to say things at least that I don't know in terms of if we're talking science. I'm actually curious to know what sort of the scientific data is in terms of cold plunges and if there's actually a cellular difference that has been made to your body when you do go into a cold plunge, like in terms of reducing inflammation. That's something that I just thought out loud there. But yeah, it'd be interesting to check that out too.
Yeah, I mean, like just as you mentioned earlier, athletes they recommend doing cold plunges a
Yeah.
lot, and I believe there is some huge amount of significance in
Mm.
terms of recovery, as in with your injuries as well. Cold plunges actually help a lot, and rather than, but this theory about having a shower in hot water, does it actually help with the injuries? Uh,
Yeah. So let's take the hot water out of it. Just think about heat, right?
yep.
So when you have an injury. People put heat packs, all this stuff. Why do we put heat? What does heat really do? Now, what it does really to a muscle, it just reduces its stiffness, relaxes it, promotes blood flow to that area, which also then reduces the stiffness around that region. Now, you putting a heat pack on your lower back, or you can just go have a hot shower, probably have the same effect of it. So it's just to reduce stiffness. Now, you could also supplement the heat pack by doing some. If you have a stiff back, depending on the severity of the stiff back. If you're so stiff you can't move, heat pack is good. But if you're stiff but you can still move, it's probably good to do some seated extensions, movement. So again, the reason why people use heat is to reduce the stiffness and increase circulation of that area. The reason why people use ice is to technically reduce inflammation or reduce the blood. It's the opposite effect. Although again, I don't know. I think putting ice after you've had an injury does little to nothing in terms of cellular benefit. It doesn't do. I think it's more of a placebo effect. Probably. It does. What it would do, I would say, is it numbs the pain because it makes that area numb because it's cold, your skin and everything. But it doesn't actually reduce the inflammation. And actually, when you do have an injury, you're not supposed to really put some ice on it because you're defeating the purpose. The reason why you're getting inflamed or it's becoming bigger is because you're sending all the right nutrients to that area to recover. So you don't necessarily, I don't think, want to stop that process. But yeah, that's...
Oh, I'm not going to stop doing cold plunge. Sure.
Cold plunge is amazing.
Oh, yeah, 100%. It helps me with...
I hate it, but it's so good.
No, actually, I love it. Actually, it's hard in the morning, specifically early in the morning when you do it.
How long do you do this for? Like in the 60 seconds to 2 minutes? Or?
No, 5 minutes.
Wow.
Oh, yeah. So...
That's amazing.
5 minutes I sit in the cold plunge and it's kind of like it's a mind thing.
It is, and I think huge benefits because of that.
Actually, it is one of the hardest thing that a person could do. And if I do that and if I successfully do that first thing in the morning, then the rest of the obstacles or impediments I have are not exactly impediments because I just overcome.
You can jump into a tub of ice during wintertime, mate. You can do everything.
Yeah, you can do almost everything. That it's kind of like a mental thing for me. It's just
it is good.
Something that I build up and started implementing, and it has helped me tremendously.
It's good.
I do recommend this, but nobody does it actually.
No. You can recommend it. I think it's a good thing. I think people should try to do it. It's better than waking up having coffee and
100%.
Whining about life.
It's just I'm not used to taking coffee, and I just never thought of going back into drinking coffie.
No, don't worry, I'm a coffee hater, so I don't want to get started and whole of Melbourne starts hating me. So
I'm not a coffee hater. It's just that I was never used to drinking coffee growing up, or tea or anything.
That's so good.
Just at the moment, just some whey protein. That's all that is.
Some whey protein. That's why I think you're doing such a good job. Like so good. Whenever I see you on the floor, like people are so engaged with you, having fun, laughing. You're not just standing there going 2, 3, 4. All right, good job. You're actually engaging, right? You're personalized. You know them. You understand their stories, and that's important as well. But anyways, it's a pleasure to talk to you, and thank you for having me. I appreciate it.
Thank you so much for coming in, and especially for the words that you just mentioned. It means a lot. It means a lot, and I give all the credits to Timespace. And just happens, and I'm just grateful. I'm just grateful for it. Just grateful for everything.
Two grateful peas in a pod.
That's it. Okay. Thank you so much for coming to the podcast.
Anytime.
Pleasure.
I'll see you in the gym.
I'll see you in the gym.